Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and we recently had a patient who wanted to know whether the pregnancy test date calculator is accurate and whether they should do their pregnancy test based on the date that they got from this calculator. I'm going to tell you what this means because it pertains to testing for pregnancy through blood tests and what this calculator actually does. So, most of these calculators are basically just an estimate of what is the earliest possible date on which you can actually do a pregnancy test to know whether you're pregnant or not. That's all that they do. And how do they do this? They do this by just estimating what is your usual cycle length. So most women know what is their average cycle length. Secondly, they will ask you for the date of your last period, and thirdly, they will also ask you for the date of your ovulation if you have it. Based on these three dates, the calculator predicts what is the earliest possible date on which you can take a pregnancy test to know whether you're pregnant or not, and I'll explain to you how they do this. So first of all, what is the information that is needed for this calculator? The first thing you need to know is what was the date of your last period. By that date, we mean the date of the first full day of bleeding of your previous period. The second is what is your average cycle length, and the third is what is your date of ovulation. Now most women will know the first two, but for the third one, the date of ovulation, you have two options. One is you maintain a measurement of your body temperature. You maintain a chart of your body temperature. Just write down the temperature of your body every morning when you wake up, and you will find that on the date of your ovulation, your temperature suddenly rises. Of course, this does not include a situation where you're sick or ill or you have a fever or something. You shouldn't have any other health issue at the time, but if you notice a slight spike in your temperature, that is the date of ovulation. This usually happens around mid-cycle, maybe day 12 to 14 of your cycle, or day 12 to 14 after your last period. Another way to check for ovulation is by home ovulation test kits. You can purchase one of these kits, and they are pretty reliable and they can tell you when you ovulated. So for these calculators, you need to provide these three dates, or at least the first two. So how do the calculators work? Well, it's pretty simple. They will take the date of your last period. They will assume that ovulation takes place around 14 days after that, and then they add around 10 to 14 days to the date of ovulation to assume that that is the time by which a growing embryo or a fetus in your uterus will begin to release the beta HCG hormone, which can be detected in the blood tests. I've explained the details of how to calculate, how many days after your last period, or what is the earliest possible date on which you can actually think of getting a pregnancy test. I've discussed that in another video. I won't go into that here. But what these calculators do is basically what I've mentioned here. They know the date of your last period, they know the date at which you ovulated, and they basically just add around 10 to 14 days to the date of ovulation, and they will tell you what is the earliest date that you can do a pregnancy test. Now, while this is a good way to calculate to get an estimate of the earliest possible date, it does not tell you the latest possible date on which you can do the pregnancy test. And for all practical purposes, the simplest thing to remember is just take the date on which you expect your next period to be, and add at least 1 or 2 days to that, and then get your pregnancy test done. And without fail, if the test is negative, make sure to repeat the test again after at least 3 to 4 days. This way you take two tests that are at least spaced 3 to 4 days apart, and you take them well past the date of your expected period. You have a high likelihood of getting a positive pregnancy test if you're really pregnant. Whatever else you do, make sure to consult your doctor. Now, what about women who have a longer cycle length? For example, if you have a 35-day long cycle, ovulation will not take place on day 14, but it will probably take place on day 21st. So this can cause a little bit of a problem, but most of these calculators factor in your cycle length before they give you an estimated date. Secondly, irregular cycles, irregular periods will make it more and more difficult to rely on these calculators because they don't account for changes in your cycle length, irregular cycles or periods because of other problems like PCOS, etc. So you've got to understand that these calculators have their limitations. The last thing that you have to remember is that it also depends on which kind of pregnancy test you're planning to take, because every pregnancy test has a different sensitivity. So some pregnancy tests can only detect the beta HCG hormone at a level of around 25 MIU per ml, which is something that will take some time to develop. Others can detect it as low as even 6 or 5 MIU per ml. and so those can detect it even earlier. So if the calculator gives you an earliest possible date, some of them will even allow you to input in the sensitivity of the test that you're going to take. But by and large, most of these dates that are arrived at from these online calculators refer to blood tests, because those are the ones that are going to be earliest positive. They don't usually refer to the urine test, because urine tests take longer to become positive.